Okay. Thanks very much.
Thank you.
I really appreciate that.
All the best.
Thank you so much.
And safe travel.
Thank you. So I'll be cycling from here at WHO headquarters in Geneva to London, where I'll meet up with a group of healthcare professionals who will be cycling from London to Glasgow to the big climate change conference that happens at the beginning of November. And what I'll be doing is delivering a report that was produced by WHO in partnership with the health community, and a letter which has been signed by organisations representing about 45 million healthcare professionals who are calling for stronger action on climate change. One of the things about climate change is that people make long-term promises on behalf of other people. There's a lot of blah, blah, blah around this. And one of the things that I and the healthcare workers that are cycling in the UK are trying to show is that we also have a personal commitment to this as well. The people who work in hospitals, or those of us who work in global health, I think take this quite personally, the effect of climate change on health. So it's also a personal commitment. We ask people to do things, but it's also important for us to walk the talk, or in this case, to bike the talk.
Well, this is a most amazing experience. I'm standing in the pod that is London, of the pollution pods, and there's something about using images to really bring a message home, and there's something about these pods representing different cities and actually sort of tangibly being able to see how different the air quality is in each that really hits home. And I've noticed there are lots of children around today, and one would hope that the message would be sinking in for them too, that actually you can't take it for granted that air is clean. We know that what happens in childhood often sets the scene for adult onset of disease. If we can intervene in childhood, we can actually prevent a lot of problems for adults later on in life. So I think there's a really important message that can be conveyed through these amazing pollution pods.
Facing that way, okay? Grab your bikes, line up, stay in your groups if possible, stop talking, stay.
We're on the bike for 6 hours.
I'm going to hand over the responsibility for this. I can stop worrying about it now, because I'm really pleased to hand it over to Finn for the NHS workers to
very
take it
much.
on to Glasgow.
And I think we will now have the anxiety of making sure we get it up to the conference, the climate conference in Scotland. The ride's starting in 9 minutes. It's going to take us 8 days, and you're speaking to someone who is not really a cyclist. It's a real challenge, but it's worth it, absolutely, definitely, because what could matter more than this?
Today is Ride for Their Lives. It's day 2 of an 8-day ride between London and Glasgow, just outside Birmingham Children's Hospital. We're meeting young people who are going to cycle with us to the Millennium Point Science Museum pollution pods.
When I think of the worlds the future generation might live in, I think of a world where air pollution is suffocating us, a world where biodiversity is compromised, where our natural resources are exhausted. This shouldn't be a worry for anyone, and there is still hope that this can be reversed.
We left Birmingham this morning and we're on our way to Sheffield. All of the world's health community coming together, sending a really strong message to the world leaders that they need to do more than they're doing. Talking is not enough. We desperately need more action.
So Toby, we've made it to Sheffield, halfway through our ride from London to Glasgow for COP26. As you know, Dr. Campbell Lendrum cycled from Geneva to give us this document to take with us up to Glasgow. It's the COP26 special report on climate change and health. We also have a healthy climate prescription that has been signed by organisations representing 45 million healthcare professionals, outlining the real significant changes that we want governments and policymakers to make. So I'm handing this over to you now to carry it for the next 4 days up to Glasgow.
Well, thank you very much for that, Finn. I will carry this. We'll be handing it over to a representative from COP26 who will then go and talk to world leaders about how things can be implemented.
I've not really done it as a one-piece before, so it's quite fun actually as well to put it up as one piece. It's also the first time that I've built it indoors, so that's been quite a special experience as well, rather than practicing the weather outside. Fortunately, we managed to have a great plan B of moving us inside the new Health Institute Centre of the Lancaster University. It's a freshly built building, so it's an absolute pleasure to work here.
Data does not change behaviour. We have the data, we have the science, but you don't change behaviour through data, you change it by changing the culture. One of the best examples of this is with smoking. We knew for decades that it gave you cancer, but there was just a certain point where it became culturally unacceptable to smoke. It's somehow socially and together it has to become unacceptable to have certain types of behaviour.
It makes you realise that something needs to be done about it. It makes you realise that it's going to get a lot worse if nothing's done.
When we were told it was 2040, I was quite shocked because that's less than 20 years away. And it shows me that we all play a role in sort of preventing this from happening.
Today's day 5. This is the leg that everyone's been dreading the most. It's 90 miles from Harrogate to Newcastle. We've also had a forecast of rain.
When I kind of spoke to a lot of people about this, they said, you know, what's a bike ride going to achieve? And I said, well, if you look at the fact that so many people have signed the letter that has been written from Geneva to London, it's brought together so many children's hospitals, and we've done some amazing things along the way. We're not going to tackle this in a day or in a week. We're not expecting people to kind of suddenly change the world in a month, but it's proven that a regular group of people can come together and really mobilise the conversation and each other.
We've got to make this accessible. It sounds a bit cliche, but you know, people can make a difference in all kinds of ways. In my organisation, whether they are somebody who cleans the environment on the wards, or a receptionist, or works in the canteen, you know, the ideas that we're getting from grassroots, and those people are going home and having conversations in their communities, and so the impact, the knock-on effect is just exponential.
It's turned out to be the best leg so far. It's been phenomenal. We've met some amazing people. Even though we knew we had 90 miles, we still took time to stop and talk to them and share the story along the way. That's what the ride's all about, connecting with people, sharing the message.
We left Newcastle when it was pitch dark at 7:30 this morning. We were given a fantastic send-off by some staff at the Great North Children's Hospital, and then we made our way to Carlisle through some pretty awful weather. We know that children, for instance, who live in countries that are some of the poorest countries on the planet, those countries actually cause the least pollution and the least impact in terms of climate change, and yet they are the most impacted. Climate change is widening health inequalities, not just in the UK but around the world. We see what this does to children. That really motivates me to want to get on my bicycle and cycle and make a noise and amplify the message. That's what gets me going and why I've really enjoyed today.
So look, first of all, really thank you, because I think it's been an amazing week, whether you've just done today, yesterday, or whether you've done the whole thing. I think it's been a really amazing experience, it's been a really bonding experience. The things I've seen is just amazing that we have cycled virtually the whole length of the country together. Through winds, some rain, and we've done it with really good spirit. Children's hospitals have been, a little bit competitive, a little bit tribal, a little bit kind of, we do it better than them. Why are they doing that service? We should do it, not them. And actually, we've got to get over that. We either stick together as a team, stick together as hospitals and make that voice for children, otherwise children are forgotten. And I know that we're all passionate about children's advocacy and getting the right thing for children in healthcare. And I think we can do that together, but we can't do that on our own as individual hospitals.
What do you think of the smell?
But it's just amazing to see you all. It won't be the last ride that we do or something together. And thank you very much for taking part. So over to Mark.
I just want you to remember why we're here. Like, we've had a great time, haven't we? We've had a blast. It's been really enjoyable, I think. But that wasn't why we did it, was it? Why we did it was to advocate for the children who are going to die because our Earth is not going in the right direction it needs to, and unless we take serious action, their inheritance from us is nothing. So that's why I did it, like, from guilt or shame or whatever, but that doesn't mean that that's the right emotion or that's something we want to do. I think it's much better for us to take action, and I think actions has made us happy and made us feel that we can actually achieve something. So turn our really happy, emotion-y stuff of what we've achieved now, which is really important, into that in the whole world, and into the paediatric group. So let's work out how we can infuse other paediatric healthcare providers to do the same as what we've done, not riding bikes, but obviously riding bikes is part of it, but being really, really looking after each other, working together as a team and making a difference.
I'm not interested in being a voice. I want the medical professionals to be the voice, but I want this to be the platform from which they speak from, because from my point of view, the words are not enough. People need to see and feel the air pollution. This is a great experience for children to go through. It really sets an agenda for them, and it's really powerful for them. They really bring that with them further. Well, why is it so polluted? Because you drive, because you're burning fires, open fires in the house, because we're buying too much, and there's this industry because of fossil fuels. And you're telling them that while they're breathing the fumes, that lasts with them.
Thank you for joining us at the end of our 800-kilometre ride today. We've carried the Healthy Climate Prescription Letter and the World Health Organization's special report on climate change and health to COP to demand action, both of which are contained within this bag, decorated with instructions sent in by Great Ormond Street Young People's Forum members and what they would want to say to world leaders if they had the chance. The cities that we have cycled through, London, Birmingham, Sheffield, Newcastle, and here in Glasgow, all contain children's hospitals where each and every day thousands of children and young people breathe toxic air whilst attending appointments and receiving life-saving care. Our ambition is for world leaders to listen and act to protect the planet for children and young people like myself. As the saying goes, action speaks louder than words. The actions that we wish to be taken from this is for world leaders to read the documents contained within this bag and do what they say. Thank you very much.
We think that we have a particular message around protecting the planet for children. We think there's specific intergenerational problems here. But now, I guess I'm thinking, what do we do with this afterwards? We've got a whole bunch of coverage, and hopefully other people in the NHS or other healthcare organisations will be inspired by it. But the main thing it's done is it's formed relationships. Within the ride, we had multiple different hospitals, multiple different specialties within each hospital, diverse groups of people who wouldn't necessarily always talk to each other. They wouldn't necessarily be in the same social groups. So hopefully we can start to build on the enthusiasm and camaraderie and everything we've achieved here, and actually start to make some changes that are going to affect the planet and help us to protect it for our patients. It's very easy to think you're alone and you can't do anything about it and nobody else cares and nobody else is prepared to do anything. So I'd like to give hope that there are other people out there that feel the same and want to do something. And so to use what we've done in this ride to harness that hope to counteract despair.
I work for WHO, very proud to work for WHO. It's a wonderful organisation that has a certain voice in the world saying what's safe for health and what isn't. But really our constituency, our team, is healthcare workers. It's the people that actually provide the protection to the health of the world's population.
Lovely, everybody, great.
Wow.
I don't think I like this. This is a very strong message, even stronger than the previous one, because now it's okay, basta, now we need to concentrate on the final one. Gosh.
Wow.
This is really...
So this is done here,
really
man.
distressing.
So if we do nothing, this is what's going to happen in the future. And it's not far off, by the way. Maybe a message for Mr. Johnson to implement PM 2.5 in the environmental.
Oh, we've got to get that, yeah. Thank you very much, guys.
Thank you, guys.
We had the opportunity as WHO to come to do our little bit, but then to join up with our team, if you like, who were doing the cycle from London to Glasgow. And I had the privilege to cycle with them for one day and to talk to them about all of their amazing work, to cycle with the representative of the Young Persons Forum of Great Ormond Street Hospital, who was the guy who I'm very pleased was handed the message to actually deliver to Glasgow. That, you know, that's made me incredibly proud.
In this session today, we're going to talk about health professional advocacy towards COP26.
Thanks, Alison. Yeah, so I'm going to tell you the story of how we got the same editorial at the same time in over 220 health journals, not just medical journals. So it was nursing journals, pharmaceutical, dental, and veterinary. What we wanted to do was get a very important message to all the delegates at the UN General Assembly. So we timed this to be before the UNGA meeting. But a second aim was that we wanted to raise the voice of health professionals. As everybody here knows, the previous 25 COPs have not included health in the main program, and we wanted to change that. And the message of our editorial, really there were just two simple messages. One, we have to do everything we can to stay below an increase in global temperature of 1.5 degrees. And secondly, we can only possibly do that if high-income countries like Britain, like the US, make bigger cuts and transfer resources and technical assistance to low and middle-income countries. And we drafted an editorial that made those points, and we then began to approach other journals about whether they would like to join this. And we were very keen that this cover the whole world. So we went to the National Medical Journal of India, we went to the Chinese Science Bulletin, we went to the Canadian Association Medical Journal, we went to the East African Medical Journal. We covered the globe so that we had everybody represented. My expectation before starting this is that about half of them would say, don't want to do that, we're not interested in publishing what other people are publishing. But the remarkable thing is almost nobody said no. Everybody said, we want to be part of that. We ended up with about 15, 16 people who were actually authors of the editorial, but then another 220 who published it at the same time. Our meeting was aimed at this meeting, COP, so we've clearly got to follow up. So whatever happens here, if it's a success, we will celebrate that. If it's a failure in some way, then we'll go back to all of the journals and say maybe you'd like to publish something more on this. But I hope in a way this will be a beginning, not an ending. This can be a continuing partnership with health journals, and we can steadily increase the number who participate. Thank you for listening to me.
Hi there, thank you so much for inviting me to be here today. It's a real honour. The idea for the ride to raise awareness of the need to tackle air pollution came from Vincent Lee, the CAD manager at the Ormond Street Hospitals. Vincent's colleagues Matt Shaw, the chief exec, and Mark Eden, a paediatrician and active travel campaigner, then championed the idea to Tom Clark of the Climate Acceptance Studios. Tom worked with, I think, each of you, Richard, Alison and Dermot, to galvanise a global coalition of partners, including the Global Climate and Health Alliance, the Clean Air Fund and BUPA. And it's thanks to these efforts, the idea that Ride for the Lives would deliver the healthy climate prescription to COP26 was born.
Thank you so much, Terry, and for telling that story. It's, as you came out with some very powerful messages in there, that in a way your journey, you were trying to express that it is a long journey, it is going to be difficult what we need to do, but it is doable, and it's really important that we all engage with it, that the health professionals are strong and convincing messengers, and that the climate crisis is a health crisis. So there was much more in there, but thank you very much for that presentation. And as I say, the blue satchel that you brought with you all the way is with us here, and we are still hoping to get our moment to present it to Alok Sharma at some point today. If not, like you say, we will take it to Sharm el Sheikh.
Wow.